Well, welcome everyone to our fifth session of the day with Roshini Kassie, the Regional Radon Specialist for the Atlantic region. Super excited to have her join us today and share all of the incredible work that Health Canada has been working on to promote radon awareness and action in Atlantic Canada and across the country for that matter. So I'm going to hand it over to Roshini to introduce herself and then chat to us about all the great work Health Canada's been doing.
Thanks so much, Lacey. And bonjour tout le monde. Hello, everybody. As Lacey mentioned, I am Roshini Kassie. I am the Regional Radon Specialist for Health Canada in the Atlantic region. For those of you who may know my name or have heard my name before, I'm not new to radon. I'm relatively new to Health Canada, but yes, there has been a lot of great work going on, and I'm really proud to share it with you. And I'm even more proud to share it with my colleagues across the country and everything too when we meet regularly. So I just want to make sure that everyone can see and hear me okay. My kitten has just woken up and he will be bouncing around. So hopefully we won't see any cats running across the screen or anything, or maybe that's what we want. But anyway, je vais présenter en anglais, mais si vous avez des questions en français, n'hésitez pas à demander dans la langue de votre choix. Pas de problème de demander en français. So you probably noticed from my background that I'm not in Halifax today. I'm actually visiting my family in Ontario. So I'm actually in the traditional, whoa, sorry, the cat just fell out of the closet. Anyways, from the traditional territory of the Haudenosaunee and the Anishinaabe people, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. And of course, you all are joining me from many different places, not just in Atlantic, but across the country. And I want to acknowledge the traditional owners and caretakers of those lands. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we are and can each, in our own way, try to move forward in a spirit of reconciliation and collaboration. So as Lacey mentioned, I'm with Health Canada. We run the National Radon Program. There are staff in Ottawa and who run the program on a national level. And then within the regions or for each province in Canada, there are people like me who do the work sort of on the ground and are, I would say, I guess, your first point of contact for any kind of regional issues or questions or ideas or projects, that kind of thing. So it's quite an extensive program, lots of great people around to help and to help support and to promote radon awareness and action. So the work that we do at the National Radon Program, again, on a national level, but also in each region, especially in Atlantic, covers these different types of activities. So helping produce technical and industry guidance, obviously outreach and stakeholder engagement, radon policy promotion, research, and supporting any kind of database and mapping creation. So there's quite a lot of cool work that we do, lots of different types of things. And I just want to highlight just a few things that just over the last couple of years that we've done on a national basis, but also in the region too. So everyone should be quite aware of Take Action on Radon, the group nationally that promotes and does a lot of our work for Radon Action Month, which is November. So happy Radon Action Month, everybody. Part of the Take Action on Radon group's work is also to do some community testing, which I'll talk about in a second. We've also at Health Canada, of course, promoted radon education to health professionals through our MAC Health program. And we've done a lot of outreach to families and to, childcare educators and so on through our Home Safety for Kids campaign, as well through our Efficient Home and Healthy Home awareness building campaign to kind of link radon with energy efficiency. And of course, you're all familiar with our radon map that was developed a couple of years ago, which is on our website. But we have been doing a lot of playing with data and mapping and spatial analysis and stuff. So our technical operations team kind of takes on this role here for us. Two major things that have happened over the last couple of years that are super important, especially in the region, or you're probably very aware of, is of course the Radon Gas That's in Your Home, our national postcard campaign, which we started, I want to say, during the pandemic. The years are all melting together in my head these days, so I apologize. I believe it was in 2020 that we started mailing out the millions and millions of postcards across the country, and we've been doing that at least once or twice a year since then. The most recent batch went out at the end of October, and maybe some of you received the postcard in the mail. But we do always get tons and tons and tons of phone calls and emails, and we've heard from organizations like the lung associations and other test kit suppliers, also getting lots of calls, lots of emails, and lots of orders for test kits. So it's a very, very successful campaign. The other thing I want to mention, and this kind of goes nicely with what Douglas asked earlier today about the Radon Monitor lending programs. So as was mentioned before, the library lending programs started in Nova Scotia in 2017, and since then they have spread across the country. There's library lending programs now basically in every province and territory in the country. And so we recognize the importance of these programs as great tools for education and outreach, and to get people thinking about what is radon. And of course, to get people accessing radon testing tools from their local libraries. Libraries are everywhere. Lots of different types of people, can access the library and borrow things for free and whatnot. So having the digital radon monitor in the library is really, really a great tool for radon awareness. And because the program has spread and there are so many different programs, we decided to create a guidance document to help not just libraries, but other organizations who were interested in developing a lending program, kind of give them some information on how to set that up and how to set that up properly. We also, as Douglas mentioned, and as we've heard many times before, these are short-term detectors. And of course, our guidance at Health Canada is to do long-term detecting. So we've developed this guidance document to, again, have that messaging in there for the librarians or for the organizations who are setting up the program, reminding them that it's just a screening tool. We've created a lot of outreach materials that go in the kit itself that remind the patrons or the people borrowing the kits that it's a screening tool. You must do the long-term test afterwards for sure. And we've also, part of this guidance document, we've worked with the CNRPP and CARST, so the Canadian National Radon Proficiency Program, and the Canadian Association of Radon Scientists and Technologists to actually develop a quality assurance calibration protocol for the monitors themselves. So this was launched last year, and we've actually been slowly kind of sending it out to the current program. So I know the Nova Scotia libraries and the PEI libraries have received this guidance document. I've helped them work through sort of the new updates and the calibration processes and stuff like that. So excellent example of a made in Atlantic, Canada, awesome thing that has gone viral, I guess. Okay, so that's sort of the national picture. Here in Atlantic Canada, I have been in this role since September 2019, and of course there was a pandemic and all that kind of stuff. We've still been able to do a lot of work, a lot of radon outreach in the region. And of course the region, yes, it's small, but there are 4 provinces, so it is quite a task. We've done 51 virtual and in-person outreach events. So this counts as, different trade shows, the home shows, health fairs, that kind of thing. We've done lots of different virtual webinars through family resource centers and seniors groups and libraries as well. We've done a lot of media interviews in both English and French in all 4 of the Atlantic provinces, TV, online, radio, print, you name it, I've done it. And I'm happy to continue doing it, obviously. And then piggybacking off the success of the postcard that has been sent nationally, we did a regional brochure covering not just radon, but other environmental health hazards. My colleagues in the chemicals management plan and the air quality health program, we all worked together on this. And so this was sent out in the fall of last year, and it definitely covered radon testing as well. So that went out to 55,000 homes in the region. Again, communities all over each of the 4 provinces. So that's the outreach side. On the stakeholder engagement and partner engagement side, this is just a few of the stakeholders who I've worked with, have partnered with on lots of different projects and programs and initiatives and ideas. Obviously, the Lung Association is a huge partner in all 4 Atlantic provinces, and doing a great job hosting this workshop so far. So great. And then of course we have partnered and worked with each of the different provinces, and will continue to do that, not just provincial representatives, but also through, public health, the teachers, education, daycares, all sorts of different groups within the provincial governments. And lately been reaching out to the municipalities in each of the 4 Atlantic provinces. So through the municipality associations and directly with municipalities too. So again, just a small list of some of the partners that we've engaged with. All right, so let me take you through, I guess, each of the Atlantic provinces and just highlight a couple of cool things that we at Health Canada, or I guess I at Health Canada, have supported since I've been in this chair. And this is by no means a complete list. I'm sure there's other things. I know there are other things going on. I just wanted to highlight a few things. So in New Brunswick, so I mentioned Take Action on Radon doing community testing, and they call their program the 100 Radon Test Kit Community Challenge. So basically what they do is they provide 100 radon test kits to a community, whether it's a municipality or another kind of community group. And then they give them the 100 radon test kits, and they help them through the process of testing. They give them the information on why it's important to test, how to do the testing, and they help them remind them when and where to set up the detectors in their homes. Excuse me. And then 3 months down the road, they follow up with the people and remind them to, gather the test kits, stop the testing, and mail it off to Take Action on Radon to the lab for their results. So it's a great kind of program that helps people through the process. Then after the results come in, they have a meeting with the municipality with their kind of community report. So it's a great little program. In New Brunswick, Moncton and Grand Falls have participated in this community challenge over the last couple of years, and you can see the percentages of homes that came back above the guideline. In PEI, as mentioned, the Radon Monitor lending program is very successful in the libraries. That started a couple of years ago and is, like I said, very popular. The public schools will be beginning testing their schools for radon actually this week. I believe on Friday they will be starting. They'll start with 20 schools this year, 20 next year, and 20 the year after that. So I've been definitely supporting them in that initiative for sure. Giving them the guidance, coaching them on where to deploy their detectors, helping them with outreach and communication with not just the parents, but the teachers and the staff as well, and other internal government stakeholders too. So it's going to be a great thing. I'm actually very excited for that. In Nova Scotia, so yes, the library lending program, again, huge hit, very popular. The MLA lending program, going really well too. Dr. Strang has been an excellent champion for us for the Radon Working Group. And actually, we're kind of hoping that, the outcome, one of the outcomes of this workshop itself will be inspiring everyone here to form a working group, either regionally or, if you want to, within your provinces to actually, push some radon actions through in your jurisdictions. And of course, happy to help support with that for sure. The 100 Test Kit Challenge has happened in Halifax in 2019. And then just this fall, we released our results from our radon gas survey in homes built after 2000 in the HRM region study that we did last year. So basically what we did in this study is we wanted to see how the radon prevention provisions in the building code were working. So we tested homes that were built between the year 2000 and 2010, so before the building code was adopted in Nova Scotia, and then the homes that were tested after the building code was adopted, so newer homes built between 2012 and 2021. We chose the areas of Spryfield, Herring Cove, Timberley, and Tantallon because those are high level areas. And we had about 200 homes participate in this survey. And you can see the results here. So if with the results coming back that were over 200 becquerels per cubic meter, they were about the same, the newer homes versus the older homes, 42% for the older homes, 40% for the newer homes. Where the interesting difference comes in is when the concentrations were over 600 becquerels, so very high. And you can see here that the newer homes were testing higher. More of the newer homes were testing way higher than the older homes. So we're imagining here a link between radon concentrations and energy efficiency. So as Melanie talked about earlier, you know, the tighter your home is for energy efficiency, the more potential you have for high levels of radon. So this is an excellent study that with some great results that we can now go and talk to, you know, the efficiency programs about. We can also talk to the building code people about as well. And on a national level, trying to, you know, strengthen the building codes in Canada. So lots more to come with this one. Okay. In Newfoundland and Labrador, so the Radon Monitor Library Lending Program was just launched this fall. So there are 10 kits in the Newfoundland side, and they travel all across the province. Seems to be going really well there too. Again, they used our Health Canada guidance document to set up the program, and I was available to help support as well. The Newfoundland English School District just completed testing of their schools. It started back in 2018 and just ended last year. And they saw that 20% of their schools were coming back over the guideline. Part of this testing program, not only did they test the schools, but of course we did a lot, like I said, we did a lot of outreach with the parents, with teachers, with other staff, did a lot of, you know, virtual presentations and stuff, encouraging just everyone to test their homes for radon, regardless of what their school level was and stuff. So all the schools that came back over guideline have either been mitigated or are in the process of being mitigated. So that's some good work going on there. And then quite a number of communities in Newfoundland and Labrador have participated in the 100 Radon Test Kit Community Challenge. And you can see again the percentages here. So again, all of these things, all these different initiatives in each of the provinces is excellent, very helpful, gets the message out, gets testing happening. And as Joseph mentioned, the newest data for the Household and Environment Survey, the 2021 results just came out. And so we can see that in Atlantic Canada, we're doing pretty good. The percentage of households that have heard of radon, so know what radon is, know that it's a health hazard, know that it's important to do something about, is pretty good. You know, between 50 and 70% of households know about radon. The testing is not so bad either. You know, there has been quite a high-ish percentage of people who have tested for radon in New Brunswick and Nova Scotia compared to Canada. In PEI and Newfoundland, of course, we need to do more. F means too low a percentage to actually publish. So what this tells me is that we're doing some great work in Atlantic Canada. We're leaders in a lot of areas, especially with the lending programs and the realtor education and so on, and the school testing as well. We're the only region who has had all the schools tested in the entire region. And so, awareness, we're doing great, but we can do better. And we need to do better in our testing, encouraging people to test. So for me, as the radon specialist, my job and what I would like to do is to move people from knowing about radon, moving them to the testing, and then of course, those that come back with the high levels, getting them to mitigate. So that's something that I'm hoping will inspire all of us in our work moving forward. How do we get people through that entire process, from knowing about it to mitigation? And so part of that, the big thing, the new big thing that has come out just recently are our radon action guides. So we've developed these documents for provinces and territories and municipalities, recognizing that we need help. Radon is a multi-jurisdictional issue. The provinces and the municipalities absolutely have a role to play and can help with radon action. And so these documents actually describe why radon action is important at the provincial and municipal level, the different regulatory and policy actions that provinces, territories, and municipalities can take. We've included lots of examples of radon policies and action from all other provinces in Canada and from other places around the world. And there's draft language in there that can be adopted too. And of course, we know there is excellent justification and rationale for why provinces and municipalities can help with radon action and awareness. As we know, health and environment are mostly a provincial jurisdiction. Municipalities have powers in public health and environment too, and also with libraries and things like this as well, and with education and outreach. So working together, I think we can absolutely, move the needle and actually get some kind of check marks off the list of our radon action plan in the region. And that's really what I've been doing. I've met with, as Dr. Strang mentioned, we at our Nova Scotia Radon Working Group talked about the radon action guides and some directions that we can take in Nova Scotia. I will be starting those discussions with New Brunswick. I have PEI and Newfoundland on the list. I know Douglas is here, so we can definitely happy to chat with them. I've also spoken to some different municipalities as well. So that work is definitely beginning and will be continuing. And of course, this workshop is part of that too. Again, here to inspire all of us to work together, whether we do it on a regional, well, for sure on a regional level, but if we want to establish provincial working groups as well and start, moving things along in each of the 4 Atlantic provinces. So here are my coordinates. Feel free to reach out anytime with any ideas or questions or projects or needs, anything at all. Our canada.ca/radon website is our Health Canada radon website, where we have all our guidance documents. The radon action guides are there. All of our outreach materials are there as well. They're free, they're for you, please use them. And then of course, takeactiononradon.ca is our National Radon Action Month kind of campaign. And that's where we send the public to find radon test kits and to find information and stuff like that. So, and the library lending or the lending program guidance documents are, you can request them through Take Action on Radon. So lots of great information there. And with that, I will take any questions.
Amazing. Thanks so much, Roshini. It's exciting to see everything that our region has been doing in radon initiatives. From Kat, what's your opinion on the quality of testing, home testing kits versus a company that does radon testing?
Home testing. So do you mean like versus if someone kind of, buys one from the Lung Association versus hiring a CNRPP measurement professional? If that's the question, then I would say, I think the quality of testing is pretty good between the two of them. I know there are quite a number of the CNRPP measurement professionals that use the AlphaTrack detectors from AccuStar, same as what someone would buy from the Lung Association. So the quality of tests are there for sure. obviously, you know, with the professional, that person then can remember to go and pick up the detector and send it away as well. I know that's something that we've talked about, you know, myself and the lung associations, of how we can help people through that process and remind them to do the testing. But I do know that when someone buys a detector from the Lung Association or from some other supplier, there are instructions in there. There's the form in there. We have forms as well, and reminders of you know, where you can place the detectors, where the best place is to, and so on. So yeah, I think the quality is there.
Great, thanks, Roshini. And just on that, we, at least for us at the Lung Association Nova Scotia and PEI, we've actually in our backend been able to implement reminders for those who bought our radon test. I believe it's around the 3 or 6 month mark, and then the 1 year mark around make sure you get your radon detector to the lab. So that's been something we've been able to implement because of our new website platform.
Excellent.
I think it also depends on your platform too.
Sorry, I see a couple of comments here, and Kelly, you're absolutely right. We definitely, obviously, Kelly's the head of radon in Canada, but we absolutely recommend that, you know, anyone who's testing for radon get a certified or an approved test kit from the CNRPP. So CNRPP certified test kits are, you know, the brands and stuff are listed on their website, and those are the ones that are listed on the takeactiononradon.ca website as well. So definitely want to make sure that the test kits are certified and that they're going to a certified lab for the analysis and results, for sure. And that kind of leads me into Peter's question of RPC in Fredericton. Yes, they definitely offer the AlphaTrack radon analysis here in Atlantic Canada. I believe they are currently going through the certification process. So right now, they're not a certified lab, so we can't really recommend, or at least Health Canada can't really recommend to use those detectors until they're certified. But I have been in touch with them and with CNRPP, and they are in process. So very soon they will be on the list and ready to roll.
And we just have one more question or comment from Jean Delaporte as well. If you want to take a peek at that, Roshini.
Sure. Oh yes. So au Nouveau-Brunswick, les communautés disent qu'elles n'ont pas d'autorité au niveau de la santé, ce serait plutôt santé publique. Oui, c'est ça. Alors, on a fait des réunions avec Vitalité. Alors, les infirmières de santé publique dans la région de Vitalité et aussi avec Horizon. So we have been in touch with public health in New Brunswick through the Vitalité and Horizon Public Health, through different public health nurses and whatnot. So those discussions are going on. Obviously, during the pandemic, you know, everyone was interested, but no one had time and energy to do it. So we're just restarting those discussions right now.
Amazing. Well, thank you everyone for joining us for our 5th session of the day. I apologize, we are running a little bit behind. If you know me, you know how time conscious I am. But let's take 10 minutes so everyone can have a little break, grab a coffee. That's what I'm going to do. Grab a snack if you need to, and we will meet back at 11:05, and we'll be joined by Todd Voss, and we'll get underway again. So I will see you at 11:05, everyone. Thank you so much, and I'll see you guys soon.